Hi there, I'm Gretchen. I currently work as a medical assistant in a rural primary care clinic in Idaho and am pursuing a career as a primary care physician. My goal is to focus on access to quality care and improvement in mental health care in rural America. I recently visited London and learned more about the National Health Service, or the NHS, which is the healthcare system in the United Kingdom. I explored the idea of what it meant to have freedom in healthcare. With a family history of both farmer suicide and cancer diagnoses, I began to focus more on what it meant to experience or have freedom in healthcare as a patient or family member with either of these experiences. In the United States, cancer treatment options can be costly for families and can include long commutes for patients in rural areas. However, the NHS has found a way to provide affordable health care for their patients to help eliminate some of these barriers and make sure that each person has access to the kind of care that they are in need of. Local physicians expressed how patients do not worry about the cost of their cancer treatment. Other examples that they gave included patients not being worried about the cost of their insulin or necessary heart medications. At the Welcome Collection, we discussed how breast cancer survivors do not have the ability yet to receive a breast prosthetic that they are comfortable and confident with. That being said, the conversation has been started about what it means for these patients to have access to and be able to afford a prosthetic that fits their lifestyle after having a mastectomy done. Access and affordability in these cases stood out to me as two values of freedom in healthcare. Physical health is only one piece of healthcare, and I kept wondering about mental health and the steps that London has taken to improve the state of mental health in their city. One organization, Thrive London, has been leading efforts to improve the mental health of every single Londoner. Understanding the after effects of farmer suicide, I was impressed with their efforts to implement and train citizens in mental health first aid. Thrive London's initiative to offer bereavement services and minimize access to the most commonly used devices for suicide was impressive. Thrive London highlighted two more of the values of what it means to have freedom in healthcare. It's autonomy and acceptance. Autonomy: they are providing ways for citizens to independently take on the responsibility to own their mental health. Acceptance: they are accepting that there's a problem and there's a way we can improve the state of mental health in a population. 4 values define what it means to have freedom in healthcare: access, affordability, acceptance, and autonomy. Moving forward, I'm now more curious to see what a post-pandemic world will look like and how we'll continue to improve upon these 4 values of freedom. What will better and easier access to quality care look like in 10 years? What would a Thrive London model look like in the United States, and how could I implement it as a provider in the future in a rural area? These questions are tricky and complex, but I look forward to pursuing the answers to each one as I continue to grow in my career in medicine. Special thanks to the University of Idaho and the College of Education, Health, and Human Sciences for making this trip possible. And as they would say in the UK, cheers!